Hi, this is Margaret Owen, and I'm going to present my paper, which was on the Respecting Choices program in the Gunderson Health System in La Crosse, Wisconsin. This program was started in 1986 by Dr. Bernard Hams. He was an ethicist who was hired in the pastoral care department, and he provided counseling for families who had loved ones in life-sustaining treatment or in critical care conditions. He found it was very difficult and very distressing for these families to try to make these decisions without ever having had conversations with their parents or loved ones regarding this type of care. And he saw a need for a type of plan to be put in place for all patients who are going through terminal illnesses or end-of-life care. So he started developing advanced care plans for those specific patients in La Crosse, and it was very successful and very well received and appreciated by the families of these patients. So after a lot of support, they established a program which is called the Respecting Choice program. And essentially this is advanced care planning for discussing and approaching patients and family members about getting advance directives in place in advance of these serious health conditions. The Respecting Choices training program offers specific training for nurses, social workers, volunteers, or really anyone who is willing to be trained for this type of role. Essentially, there are 8 hours of in-class instruction, which involves role-playing and conversations and competency training that is specific to the individual needs and circumstances of the patients in various settings. There's also additional online training that prepares for the classroom instruction prior to the beginning of the program in La Crosse. So in order for a participant to complete the training, they need to be able to be competent in several aspects of the planning process. They need to be able to successfully initiate conversations with patients and be comfortable working with patients or their families or a healthcare agent regarding advance directives. They need to be ready and willing to provide assistance in the planning process of these advanced care directives. And they need to make sure that those plans are clear and concise and complete, representing the patient or individual's values, beliefs, and goals. Finally, the directives need to be honored by the healthcare system and documented in the medical records to be accessed at any time or in any place in the healthcare system. As I mentioned to you, the Respecting Choices program has been very successful in the Gunderson Health System and in other health systems across the country. There are many health systems who are replicating the system and in implementing it into their hospitals and other care facilities. The Respecting Choices program has helped to implement and train over 2,000 advanced care planning facilitators. And they have certified more than 500 instructors who can essentially be certified and go out and train others in this program. They have established programs in Canada, Spain, Germany, Singapore, and Australia, as well as their American sites nationwide. When comparing the Respecting Choices program to other possibilities, for example, the DNRs or Do Not Resuscitate or Living Wills, they really limit the ability for care providers to make choices, and they're not comprehensive enough to cover all the different situations that they might encounter in this critical care area. There are also other very similar advanced directive programs like the Conversation Project that was mentioned in our lecture. And there's an advanced directive program called Five Wishes that is online, and they do promote these personal conversations with family members, and they promote completing an advanced directive, but they are not the systematic approach that Respecting Choices has used and been shown to be proven successful in a healthcare community. Unfortunately, I cannot really provide pros and cons of the specifics of the program itself without going through the training that they provide in La Crosse. So I cannot offer any possible changes or enhancements that I would make. But just to let you know, I am going to be going through this training this October, and I am working on a grant for our local health service, our local community, to pay for my training, both as a facilitator and perhaps as a trainer as well. I do feel very strongly that these programs are absolutely essential to our future in healthcare reform. And not only does it help to focus on patient-centered care and the patient's needs versus the services provided, but it also can save a great deal of money in medical care, knowing the patients usually prefer comfort care at end-of-life stages or in terminal illness conditions, and can provide quality of life for these patients in these situations. The Self-Determination Act, which was passed in 1990, does require that information be provided to patients about advanced directives and gives them the rights for acceptance or refusal of treatments, life-sustaining treatments as such. But it really does not mandate that everybody get fully engaged and participating in advanced care planning, which is truly the goal that we want to try to achieve in the long term. If Medicare could fund this type of campaign, certainly it would be an expensive undertaking. But the millions of dollars that Medicare can save in lowering expenses associated with fewer hospital stays and choosing comfort care over expensive life-sustaining treatment would more than justify those costs. And more importantly, it would create a paradigm shift in the delivery of critical and end-of-life care in our country. Thank you. That concludes my presentation.